Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jess Czelusniak. She's Associate Vice President of Applications and CNIO at VHC Health, and Tim Hoskins, Vice President of Solutions Architect at Vyne Medical. Welcome.
Thanks for
Thank you
having
for
us.
having me.
Yeah, excited for this discussion. Lots to talk about. Really interesting project you all have been working on to improve, the work you do at VHC Health. But before we go there, Tim, why don't you start us off? Tell us about yourself and Vyne Medical.
Yeah, Tim Hoskins, been with Vyne Medical for 25 years, which is crazy. I started out writing code in my 20s and I'm still here.
Wow.
But yeah, Vyne, we started in voice automation and recording technologies and then moved into digital document workflow. Back in the days of, paper faxing, we migrated folks to digital and then eventually cloud. And then once machine learning and AI technologies came about, we really moved, really the entire organization into the automation space. So that's kind of been our focus for the last 4 or 5 years. So yeah, that's what we do.
Awesome. Jess, how about yourself and VHC Health?
Yeah, so I'm Jess Czelusniak, as you said. I'm an emergency nurse by background. I worked in the ER for about 7 or 8 years before moving over to IT. I've been in IT now for about 15 years. At VHC Health for 9. It'll be 9 in January, which time flies. VHC Health. So VHC Health is a one hospital health system. We're 537 beds just outside of Washington, D.C. in Arlington. We're a level 2 trauma center. We see about 65,000 emergency department patients a year, and we're a magnet designated hospital. So we also received just this year the Medicare Center's 5-star rating, which is the highest rating you could get. So we're very proud of that.
That's awesome.
Yeah.
Well, and I love having nurses on. Nurses are the golden element of healthcare. So I always love the nurse perspective, and ER nurse even better. You're a brave soul too. That's awesome. Great to have you both on. So just give me a quick, kind of before and after on your document management at VHC Health. And I'd love to hear, like what made you realize that kind of people powering your faxes wasn't a sustainable option and that you needed to leverage the workflow automation that Tim talked about that they're working on at Vyne.
Yeah, the before picture was very manual and not paper faxes, but we still have those. We can talk about that later. But it was a lot of work for team members to get a fax, an e-fax from outside of our system into our EMR. There were folders and it was just very complex. There was a 29 page tip sheet on how to get this information from this eFax folder into Epic, which is our EMR. There was no automation, and this worked great years ago, but we've changed a lot over the years. We've grown tremendously. I think when I started at VHC, we were like a 350 bed hospital. So we've grown tremendously. We're up to, 537. The after picture is much different. It's automation. So coming in, our time spent on a single fax went from 10 to 15 minutes down to less than 3 minutes. And that's probably even higher now that the teams are used to the system and know what they're doing. The user interface within Vyne is so much better. Before that, like I said, they were working just from folders. And imagine a folder in your hard drive on your computer. They would just open it. It would be this gibberish of a title because it's just coming through fax. They didn't know what it was. They would have to click on every single one, figure out what to do, work between the two systems. With Vyne, it's this great user interface where they can clearly see the document. They still need to determine what to do with it. There's automation there to help them. Pulls out the name and the date of birth, uses our system to match to see if we already have a patient in there, and we'll make that connection for the user, which is huge. And then they send that document over into the EMR. So they just work in one system. They don't have to jump between 2 or 3 systems to get these documents over. What made us realize, I think you said people powering fax wasn't going to cut it anymore. I think it was just the sheer volume.
Yeah.
The number of faxes that we are getting now with the government requiring the sharing of information and the notification of providers of anything. So if a provider's listed, the primary care provider's listed on your EMR, you get admitted to the ER, you get discharged, all of that gets sent. And if there's not a direct connect, it comes through fax. Direct connect being like an interface or direct address. It comes through fax. And we've grown tremendously in our patient population. And it was just too much. That it used to be the front desk person would index faxes and do the work and send them over. Well, we can't do that anymore. So it was just the sheer volume, and just that sustainability. It wasn't sustainable. We were falling behind. There were faxes that it was taking longer to get them done, and we needed more people. So I think that's really what pushed us into this project.
It's so interesting because just hearing you talk about that 29-page document, that actually means you were a good healthcare organization that actually documented all of the details of what was required to do the vaccine. I think, and Tim probably knows this better than I, in many organizations that resides in the minds of 3 people who have, sorted faxes for years and has never been documented. And so how do we automate? The fact that you actually documented it
is so rare, John. It's crazy because literally when Jess provided us with that document, it's the first time I'd ever seen the workflow documented by any health system. We usually have to go in and do a complete workflow assessment to get that knowledge from all those myriad of people. So yeah, it was shocking, and it really helped us to streamline the workflow for sure, knowing how it was being done.
Yeah, it's shocking to see it written down too. For 29 pages and all the steps that these people had to do. And I think if I remember right, there's like this pause where when it would go from one system to another, they had to wait like 3 minutes because of the other system. So it's not like they could just move from one thing to another. They had to remember to wait 3 minutes before they could move to step, 15. And then not get distracted with something else, maybe somebody coming to the front desk, and remember to go into the next system and complete the task. And those were the things that were falling behind. They would forget, wait, which patient was I on? There was no record. There's a lot of areas for opportunity with our old process.
Yeah, so fascinating. Well, obviously it made the implementation smoother, the fact that you'd actually documented it. I love that. What would you say, maybe changed the most as you moved from humans to automation? You talked about the interface being much smoother, much easier, and talk about the, what did the Vyne medical implementation kind of look like week to week? Like how did that, change is always hard in any situation, not just healthcare, but, talk to us about the kind of the implementation and what you saw change, moving from humans to automation.
So I think what we saw change there was angst. There's always angst with users when you move from one system to another, even though you're making it better. And we saw that in this. And it was a lot of time and a lot of patience on my part to say the systems, it's not the system, right? There were times when, the technical things weren't routing right, but we worked through all those. And those are very black and white. I want this document to go to this folder, and it's not landing there. So my team can go back and look at that and say, oh, this is what we need to do. And they'll work with their technical support and have it routed there. And so we worked through that, which took time because it's complex. We have like 100 doc types that could be used to index a fax, and we need to send those all to the appropriate places inside our EMR. But once we got through that, there's still a human part of this. So I think the human part has not gone away yet. We're getting closer. We're removing them more and more from the process, but it's still there. But there's a decision that has to be made by somebody as to where that document's going to go. And that's where we ran into some angst with some of the providers, and really saying, okay, it's not the system. The zeros and ones are working. It's doing what we're telling it to do. We need the human factor to be able to, standardize that. And we worked through training and standardized training, went back and trained some more. But going back, like I think you said, what did our week-to-week implementation look like? It was intense implementation. We worked really hard, really fast. There was a lot of technical build. Once that document comes out of of Vyne. We use OnBase as our document management system, so had to go there and then over to Epic. So there's a lot of technical pieces, but it was many meetings, dynamic meetings, because we were changing, we were updating, and this didn't land exactly where we wanted, or it went here, but it's also supposed to go here and it didn't go there. We had doctors, we had one doctor in particular on the operational side that really helped us. Our biggest group of users of the system and our faxes coming in is our ambulatory provider groups. So it's VHC Health Medical Group. I mean, it's all the ambulatory doctors getting the notifications for all their patients. They get millions of fax pages a year. So we had a doctor on that side. She was a doctor taking care of patients, and she moved kind of into an admin role, and she was really our point of contact to help us translate those needs. And she was key. She really helped us with the workflows and where things should land, help train the staff. So it was a lot of, so going back to your question, what did the week to week look like? Lots of meetings, dynamic meetings, testing, working through the technical pieces, not just with Vyne and my technical team, but also with our operational end users, really understanding their workflows, bringing them into the fold to make sure what we're building makes sense to them. Because sometimes on the technical side, it looks good, but it doesn't actually, in theory, work. But it was a great joint effort. And we got through it. There's a lot, and we're still moving through. We're still bringing other groups live.
Yeah, well, more faxes are going to come from different people, different angles, different interoperability as well. Yeah, it's interesting. I love this discussion because I think many CIOs probably look at it and think, oh, well, fax just comes in, you sort it, you're done. And what you described is much more complex and important to the organization, making sure it goes to the right place, to the right person at the right time. Tim, I'd love to hear your perspective, and kind of Vyne Medical's perspective on VHC's evolution. And do you see this across a lot of your clients, this kind of same challenge of overwhelmed with faxes, and how do we get them in the right place at the right time?
Yeah, I mean, at VHC, because we started with the ambulatory, just kind of tag on to what Jess was saying, it's not unique, right, to any healthcare organization. The challenge in the disparity, right? So if you have 20 plus ambulatory locations, which they do, and every single location would get a document in and say, oh, this is an outside record. And then the next location would say, no, it's an HMP. And the next location would say, no, it's a this, right? And with automation and standardization, you're using the machine learning and AI to say, no, this is what it always is, right? Because it is a history and physical, right? It's not just random outside record. And so getting to that standardization, like Jess said, is a challenge because you have to move the users along as well, right? And that's not unique, but over time, you can get there. But yeah, just the disparity, and then the key thing being, the end user when they're validating this and pushing it through to the EMR in their case, it's so clinically relevant. That was the big thing. Again, not unique to VHC, but what CIOs and CMIOs have to recognize is when a fax that has some important result for a patient is sitting in a queue for 2 weeks, 3 weeks, because there's a backlog, then that result doesn't get routed to the provider to review so that they can contact their patient, say, good news, you don't have cancer, right? Or whatever that result might be. And so the importance of getting that right with the automation. So certain doc types in our system have rules that say, hey, the provider or multiple providers or clinical pools have to be tagged based on what this document is. That was, I think, a big win for VHC in that in the old process, that was just a human remembering to do that step, right? And as Jess mentioned, with that pause in the middle, that's where that could get missed, right? And so yes, the document got into Epic, but it never got routed to Dr. Smith, right? So by having guardrails around that, I think that was kind of a huge clinical win in implementing the system. But yeah, I mean, it's like Jess said, there's a lot of technical build, there's a lot of sort of decision by committee, and luckily with several of the physicians that were involved in the project, which is really key. I think we have the most success with clients when we have that, CMIO or some type of physician buy-in, because they can help really guide those clinical decisions like, this is what this document is, this is what it'll always be, and this is how we're going to automate it. So that's kind of really key, to not, like Jess said, not just have a bunch of IT people saying this is how it should work, right? Because at the end of the day,
Right.
the clinicians are what matter, at the end of the day.
Yeah. And it's great that you had that buy-in. I think that's a challenge for many organizations as well.
Yeah.
But Jess, do you have like a favorite hard number or stat from this project, that kind of exemplifies, what was done, maybe time saved, or I don't know, what's your favorite stat or result from this project?
I think it goes back to one, trashing that 29-page tip sheet, and we're down to a one pager probably, and that time saving down to less than 3 minutes. That down from 15, and the accuracy of that. So kind of going back, it's not a hard number. So time save, going back to hard number, 3 minute. That 3 minutes now that it's taking the front desk people or the team to be able to do this work, and that amount time saved they can now spend with patients or doing the other things that they need to do.
So it used to take 15 minutes per record, and now, or per fax or whatever it is, and now it takes 3 minutes. Wow.
Less than 3. And I bet you they're even faster than that, because I haven't sat with them in a while, because they're just off and running at this point. Sure. But I think Tim brought up something else. It's not a hard number, but getting those results to those doctors in a timely manner is invaluable. That you can't put a price on that. Those results, they would get, like Tim said, they would get there, they would get slow, or they'd be in Epic and nobody knew they would be in Epic. For whatever reason, they're getting to the doctors. And then not only are they getting to the doctors in basket, Dr. Smith to see, it's also filing appropriately inside of Epic in the right review tab. So it'll file to a radiology or a lab tab or a cardiology tab. So not only can Dr. Smith see it, but if Dr. Lynn comes in and is consulting on the case, he can see the results inside those tabs as well. So it's there for everybody to see, and it's not just, and it's in a logical place. So I think we did a lot of work with that. And that's one of the things. It's not a hard number, but I think that's been one of the biggest wins for our organization, is just getting those really important things to the provider, results, labs, whatever it might be, imaging, to those providers in a timely manner.
Yeah. It's interesting because, clinicians have always treated patients with, without the full picture, but if the data is available and they don't get it, it's really frustrating for them. So,
and yes, they were very frustrated. There were times when they were very, very frustrated, because they weren't seeing things, and patients were getting them in there were times when a patient would have it inside their MyChart in their portal before the provider could see it. So it's so much better now. I don't want to jinx things. I won't say too much, but we are doing great right now, I think.
But it's funny how this has such a corollary. I mean, we used to go searching for the paper chart and not be able to find it. Now we just search one search and we get all the information in the EHR. And now we just take that for granted. I imagine it's the same for you, that now instead of searching for that fax that hasn't been sorted, now it's just there. And we're going to take it for granted as well. Tim, is there any stat that kind of stood out for you in this project that, maybe accuracy, or I don't know, what stat stood out for you?
Yeah, I think something that stood out to me was we started with kind of a test group, which was the surgery, outpatient surgery group. And by the way, shout out to Fatima, she's amazing in that group. But they had the highest volume of any department. Because every request for surgery came through as a fax, right?
Makes sense.
And it was, I think the coolest thing for me was that delight. Like, they were very change averse. And when we implemented, we came to this realization on day one, of implementation, that the biggest struggle they had was prioritizing the surgeries. So on their request form, they had a field that said surgery request date, right? And so I was like, oh, we didn't catch that in the pre-workflow. let's make a quick change. So within 10 minutes, we changed the automation to pull out that requested surgery date. And then we sorted their work based on the surgery they want to have tomorrow, right? Oh my gosh, you'd think we changed the world for that whole team. They were like so delighted. They're like, "Oh my gosh, now we're always working on the most important urgent surgery request." And it was a complete game changer for their whole workflow. And then the other thing I was kind of delighted about was with handwriting recognition, we conservatively tell clients, 65%-ish on the handwritten stuff. And that surgery group gets a lot of handwritten documents in. And, we were very hopeful we would get really good results. And I think the last time I spot checked it, we were somewhere between like 82 and 85% recognition with the handwritten stuff, which is just phenomenal. So they're still getting a great automation rate, even with the stuff that's handwritten, which has really, really streamlined their workflow. So, yeah.
AI is improving even with handwriting. I love that.
Oh, yeah.
And it's amazing they're still getting so many. There's probably a study that's needed there, but I'm glad you
Yeah.
can help deal with that
Yeah.
problem. Jess, what was your experience with the staff and how did they react to the project? Were there some skeptics? It sounds like there was. You kind of mentioned some reticence from some people. Change is always hard, and how do they think about the project now?
So I think we all knew at the start we needed to do something, but change is hard. So there were some points they were like, we're gonna go back, and I was like, there's no way we're gonna go back. We will be fine. We're working through. We're identifying things. There was, I think, where some of the angst came in was highlighting. We really saw bad processes that we had before were very much highlighted now in this automated flow, and that just came to light, which they probably didn't notice as much before because it wasn't a way to see it. So working through that with them, and having them understand that sometimes there's technical issues, not really anymore, knock on wood. It was user and training and going back and saying, well, this was filed as, a mammogram because that's what the person selected. So let's go back and talk to Jess and see why she selected that and help her learn. So there were skeptics. It was a rough go in the beginning a little bit working through it. But once we got through it, they realized the time saved for their users and the automation that's provided, and the AI to be able to pull out the key information on those faxes. The system Vyne can read the faxes and pull out key information, making it even faster. So sometimes there's no clicks, getting rid of spam and junk. So I think the whole process is much more efficient. Now I think it's the users that do this faxing there's a high turnover rate. So we're constantly training and bringing on new people, and I help manage those. But I think we're fine. They've got a process down. They've got key people at each site that really know the workflows and can train others. So they're I think thankful now that we're through the difficult part where change is hard. But
yeah,
that's what I was thinking. Like training someone on a 29-page document is not easy, and this had to simplify the training to some degree as well, since it's doing a lot of the work for you. And it, as Tim said, it's standardizing some of that categorization and indicating where it might need to go. That's really interesting.
And we did have to remind them of that. Look how far we've come, right? Like we would talk through issues they were having, and sometimes I would have to ask them, like, let's step back for a second. I know you're having this issue and you're really worried about how this is all working together, but where we've come from, where we were and where we are now are leaps and bounds. Like we can't go back. It would be like getting rid of Epic and going back to a paper chart by choice. Like that's like like mind blowing. You would never do that. So we worked through it, and like I said, that engagement and the providers and having those key stakeholders was key. Just like Tim said, having those people who were bought into the project on the operational side to help support us was instrumental.
Yeah,
it's a classic IT problem, right? Once you automate something, we take it for granted and just assume that's how it was always done, and we forget about how hard it was before.
Yeah.
Tim, I'd love to hear, like, you work with a lot of organizations, automating a lot of faxes and documents and other things. But what are some of the signals that you see that you think it is time to make the effort that Jess and her team did to automate these processes? And are there any automation or AI kind of myths that people are afraid of that maybe should be retired and they should embrace automation?
Yeah, I think this is one I tell clients all the time is if you go to your hospital or your health system or ambulatory clinic or skilled nursing facility, I mean anything in healthcare, you go to your company website and click careers, and there's an opening for some type of clerical position, you are ready for automation, right? Because the cost to automate is so much cheaper than the cost of a fully loaded FTE. It's just, I mean, you have to realize that. I heard a funny quote from a client. They said, well, we've got to look at automation because our best indexer, our best data entry person, just got a better paying job at Panda Express, right? So that's the competition. They're like, we're paying 18 an hour plus benefits, and Panda Express stole them for 22, right? And it's like, that seems ludicrous, but it's true. It's like keeping and hiring is so difficult today in our current economic landscape that you have to really be looking at automation. So I'd say if you have positions open, and especially if you can't fill them, that's where automation is significantly less expensive to implement. Yes, it's a complex technical project like Jess mentioned, but once you get it implemented and in place, yeah, the night and day difference is pretty stark. The other thing I think, I'd say AI myths is, that some people come into a project like this and they're like, well, then everything will just be automagic, right? It's just nobody has to touch anything, nobody has to do anything. And we do have customers that reach certain thresholds with certain document types where they're like, yeah, go ahead and just start pushing that through. We don't need a human to look at it. Typically, those tend to be documents that are not clinically relevant, right? It's like payer communications, lockbox data you get from the bank, remittances, there's all kinds of different things, photo IDs, insurance cards, those can just get pushed through. I think it's important to dispel the myth that, with clinical documents, you don't need to look at them because they're clinically relevant. They're super important for patient care. Like Jess mentioned, that it does show up on the right tab. The automation's there to do the work for you, but having a user at least put an eye on it and then click send. So even if they only spent 2 seconds on it, I think it's important just to keep in mind that clinical documents are clinically relevant to the patient, and a human should put an eyeball on it. So that's kind of one of the myths. And then the other one is, as we start in our organization, as we're moving into Gen AI in 2026, again, to assist in the matching and doing more advanced things with our automation. Just that, Gen AI isn't a panacea that's going to solve, every problem. I think it's still important to put a human eye on something, even if we're, reaching higher and higher levels of full automation. So,
yeah. Sounds like what you're saying is that 3 minutes still matters. And thankfully, it's not 15,
yeah,
but the 3 minutes is still valuable.
It still matters. I think what our goal at Vyne Medical is that 3 minutes to turn into 3 seconds, right? Yeah, if it's 3 seconds, but someone's placed an eye on it and they're like, yeah, this looks good, and pushed it through to the patient chart. Yeah.
Yeah. Jess, anything you'd add? And I'd love to hear, kind of what's next on your roadmap as well.
I think the one thing to add, talking about the clinical documents needing an eye on them, is a lot of times we have a lot of automated faxes out of Epic to other systems. And some of the outside groups, it's not automated. So it's a person on the outside sending that in. So it may not be accurate. So which one page may not match the second page. And so having clinical eyes on that to see that it's a cover sheet for Tim, but it's a result for Jessica on the second page, and really making sure that those things are accurate. So I do think it's vitally important, because there could be critical information coming in about patients, and we want it to get to the right place. So well, I'd love for it to get down to 3 seconds. And I think there are times when they're just scanning through, because now we have so many things just the system just looking at automatically and pulling out. They might just be pushing a bunch of those through. So I think we're getting there slowly but surely, but healthcare and clinical information and patients are so complex that I think, having an eye on those often, or most of the time, is going to be key. I think signals is time to automate. I think you asked about the volume, just pure volume. And like Tim said, if you have those clerical positions, having people in healthcare, we want people working at the top of their license. Like I don't need a doctor indexing faxes or searching for I need them taking care of the patients and diagnosing and placing orders. So really using automation to help take out some of that stuff, so that can be automated, so your team members can work at the top of their scope, whatever license or scope, whatever that may be. Our roadmap. So our roadmap with Vyne, we are still looking to automate more documents. I work regularly with Vyne. They're actually waiting for me to send some stuff back to them now. We're working with Vyne on signatures, being able to sign faxes coming in. So our docs get a lot of, hey, can you complete this form for me? I need to get physical therapy, or I need this DME form filled out. And those are coming in via fax. And we're working with Vyne on how we can do those inside the system, so we don't have to print, take them to the doctor to sign. He gives it back, they scan it back in, they fax it. So it's all within the system. So we're working through that, which I'm very excited about.
And hot off the press, Jess, our release that we put out as of yesterday, now you can route signatures via Epic in-basket message. So
yeah, that's what we're trying to get our test system upgraded so we can test it. We want to get our little mitts on that, and get that tested in our system. So we're working through that too. I think in more departments. So John, more departments are coming out. I don't know. We're one hospital, like I said, but we came across a department that's been doing paper faxes, and they get a significant number of faxes, and they weren't on my list on the initial implementation project. And I realized they weren't on my list because the people on my list were getting e-faxes. That's where we started, the e-faxes coming in. They weren't even getting e-faxes. Everything was still on paper, which like hurts my heart a little bit. So they weren't on my radar at all. And I came across them, and they were printing faxes, and there's various steps. They have to get insurance authorization. They need to make sure they have certain labs. So it's for our outpatient infusion centers, a very manual process. And I was down there rounding, and I was like, I think Vyne could help you guys. So Vyne came in, they did a workflow assessment, and they are now up, and they love it. They love it. And they're able to put things in different queues and move patients through, and everybody can see where everything is. And they had paper packets with like a little paper check sheet, like old school. So that's like my success story. They've been live for a little bit now. I wanted them to get settled. I'm going to go down there and check on them, see how they're doing, but they seem to be doing great. So I think it's more of that, finding the ones that we didn't know about that could utilize this. What are more technologies like the signatures that we can do within Vyne? And then how can we make those touch points less for the end users actually doing the indexing, training more documents and things like that.
Yeah. What a fascinating story. I was going to say shadow IT bites again, but I don't know if we consider paper fax IT anymore.
What is that?
That's an amazing story. Jess, Tim, this is a great use case. I appreciate your, sharing it with us, and the way you approached it, and how you helped to, work really hard, right? I mean, I acknowledge that it takes hard work to redesign workflows like this and be able to solve them, and improve your organization, to improve the care that you're able to provide patients, and to also, obviously, help the burnout of your clinicians and everyone as well, by having the information there and done quickly. So thanks to both of you for taking time to talk with us here at Healthcare IT Today. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com, or search for Healthcare IT Today on your favorite podcasting applications. Thanks so much.
Thanks.
Thank you.